makes the regional picture so important, as we've learned through the weeks. Here's the Prime Minister of Canada, and let's go to him now.
Good morning, everyone. I know many of you have seen reports about my mum. I want to let you know that I've spoken with her and she's doing just fine. I'm thankful to everyone who's reached out and want to also thank the first responders who were there doing an extraordinary job. This morning, our thoughts go out to those of you who live in Fort McMurray as you deal with spring flooding. Minister Blair has spoken with Mayor Scott about the situation, and we stand ready to help. To all the first responders and volunteers out there placing sandbags, including around the hospital, thank you. Across the country, there are other communities dealing with flooding right now too. So to everyone, continue listening to officials as they work to keep you and your family safe. This comes during what's already a tough time, but I know Canadians will continue to work together. Shortly, I'll join members of Parliament from across the country for a virtual meeting of the House of Commons. Despite the challenges of this pandemic, our democratic institutions are innovating and finding ways to keep serving people. Parliamentarians are working together with the same goal, supporting Canadians and keeping our country strong. As part of this sitting, at noon, Minister Hajdu will provide an update on the new COVID-19 modelling, and Dr. Tam will also do the same. Based on the best data available, this is an updated picture of where we think we are right now and where we think things will go from here. They'll provide more details, but here's the bottom line. The measures we've taken so far are working. In fact, in many parts of the country, the curve has flattened, but we're not out of the woods yet. We're in the middle of the most serious public health emergency Canada has ever seen, and if we lift measures too quickly, we might lose the progress we've made. So we all need to be very careful for ourselves and especially for the most vulnerable, like our parents, grandparents, and elders in long-term care facilities. Earlier this month, when we released the first modelling, I said that the path ahead was up to us. And the same holds true today. How many new cases there are, how many losses we have to mourn, whether our hospitals can continue to cope. It's all up to all of us. You've already stepped up to help your family, friends, neighbours, and frontline care workers stay safe. And your governments across the country are stepping up as well. We're a big country and we don't always agree on everything. But right now, the premiers and the federal government are working together to fight this crisis. We need common guidelines to make sure that the decisions being taken across the country are grounded in a shared understanding and appreciation of what science and experts are telling us. Shortly, we'll be releasing the shared principles on restarting the economy agreed to by the federal, provincial, and territorial governments. Let me be clear. These are not the specific measures when you can go back to work or school or when you can see your neighbors or extended family or friends. This framework will lay out the things that need to happen before we take any next steps. Restarting our economy will be gradual and careful and will be guided by science. Here's what the guidelines mean for you. Controlling transmission is key. You already know that if your neighborhood doesn't have new cases, if your province is flattening the curve, this is a good sign for being able to slowly look at lifting some restrictions. So we need to know where things stand. To reopen the economy, there must be enough capacity to test and trace COVID-19 to control any new spread. For you, that means knowing that you'll be safe at work when you go back. You'll see lots more testing, and if someone around you does test positive, you'll be notified quickly so you can isolate. At work, there will also need to be specific measures and more equipment to keep you safe. And for hospitals, we need to make sure they can continue to cope not just for COVID-19 patients, but for everyone who needs care. And for certain groups who are very vulnerable, like seniors and those in long-term care facilities, strong measures will have to be in place for longer. This virus is taking a different toll on different people. We must be mindful of that. Whether you're facing domestic violence, or living in a remote community, or a long-term care facility, we're working on the front lines. We're here for you. Our priority is keeping all Canadians safe while getting back to normal as much as we can. Aujourd'hui, on publie les dernières
Today,
prévisions.
we are presenting the most recent predictions with respect to the evolution of COVID-19. In many regions, COVID has slowed down, but we're not out of the woods. We are in the midst of one of the most serious public health emergencies in the history of our country. And if we lift the restrictions too soon, we could lose all the progress we've already made. Even though the trends are encouraging, we must remain cautious. There are some places, particularly in seniors' homes, where we're going to have to do more. And as I've already said, every single one of us will decide on how things proceed, how many new cases we'll have, how many families will be mourning, whether our healthcare system will be able to cope. All of this depends on all of us. The good news is that people are taking the proper actions to protect themselves and others. But we must continue. We must continue to stay home and go and do our groceries once a week and keep a 2-meter distance from others and follow the public health directives. Soon, we will be sharing all the common principles with respect to restarting the economy on which the federal government and provincial and territorial governments agreed. These principles will set out the conditions that must be in place before we can begin to lift the restrictions. For example, the ability to test and trace COVID-19 must be sufficient to be able to control the spread. And that's why we are intensifying testing and putting in place the necessary tools as quickly as possible. There must also be specific measures and new equipment to protect people at work. And for certain particularly vulnerable groups, such as seniors and people living in long-term care facilities, more robust measures will have to remain in place longer. Our priority is to ensure the safety of all Canadians as we start to see normal life return.
Provide an update on personal protective equipment, which, along with physical distancing, is key to keeping people safe. Every few days, we receive new deliveries of vital supplies for our frontline workers. This week, we'll be shipping over 6 million surgical masks to the provinces and territories. More than 100,000 face shields that we ordered from Bauer and Toronto Stamp are also ready and will be shipped out soon, with more on the way. Everyone deserves to be safe on the job. Indeed, on this National Day of Mourning, we remember those who died, were injured, or fell ill because of their work. And this year, we pay tribute to the thousands of frontline workers across the country who deserve not just our thanks, but our support. Aujourd'hui,
Today, I'd also like to update you on individual protective equipment that ensures the safety of our frontline workers. We are receiving shipments of medical equipment several times a week. This week, we will be sending more than 6 million surgical masks to the provinces and territories. More than 100,000 face shields that we ordered from Bauer and Toronto Stamp are also ready and will be sent out very soon. Everyone deserves to be safe at work. On this day of national mourning, we remember those who lost their lives, who were injured, or who fell ill as they did their job. And this year, we are saluting our frontline workers across the country who deserve not only our thanks, but also our support. I also want to remind everyone that the businesses that require a wage subsidy can now apply online. Since yesterday, more than 44,000 businesses have already applied online.
To get through this, we must work together, and we must stay united. Now, more than ever, we have to stand up against discrimination and division. There is no place for racism against Asian Canadians in our neighbourhoods. There is no place for anti-Semitism, which B'nai B'rith Canada's report found to be on the rise in our communities, because hatred of any sort has no place in Canada. Today and every day, we are stronger together. Merci.
Thank you, Prime Minister. We'll now take questions on the phone. Over to you, operator.
Thank you. Merci. First question, Kate Bolongaro, Bloomberg. Line open.
Hello, Prime Minister. I have a question regarding the wage subsidy. We've heard from some businesses that it will cost them more money to rehire employees they've already laid off and had to pay out holidays and severance pay to than to bring them back on board with this wage subsidy. So some of them would rather leave their former employees unserved. What is your response to this?
Ideally, people will keep their connections with their workplaces so that they can know that they have a job to return to when this is over. And when the economy comes back, it will be all the quicker because Canadians will have stayed connected to their jobs. We were pleased that over 44,000 businesses have applied for the wage subsidy. But we know that there are a range of different situations across the country, and employers have had to take some very difficult decisions because of COVID-19. We've put in place measures to support the people who need support most urgently with the Canada Emergency Response Benefit and the wage subsidy. And we certainly hope that all these measures together will ensure that Canadians can continue to do what we need to do while caring for their families and come back as strongly as possible at the end.
Follow-up, Kate.
And now we've got a lot of personal protective equipment for the frontline workers. I'm wondering, do you expect businesses to chase PPP as well now that the reopening of the economy is beginning to be considered? And do you think there will be enough masks and gloves available for all of the businesses that will need them to be able to operate?
Our priority over the past weeks has been to ensure enough personal protective equipment for our frontline workers who are doing extraordinary work to keep us all safe. But we also know that as different provinces look at starting to reopen certain sectors, certain industries, certain parts of the economy, there is going to be an increased need for personal protective equipment. That's why we continue to procure massive amounts of PPE from overseas, while at the same time watching the Canadian production come online so that we can have our domestic capacity to rely on as well. We know that having the right amounts of PPE for industries that want to reopen will be essential before they reopen, and that's why we're accelerating the rate at which we are taking in personal protective equipment. Okay. Nous savons que la priorité a toujours été.
We know that the priority has always been to ensure there is enough PPE for our frontline workers and healthcare workers, and that's why we've been working very hard in recent weeks. But as we are now looking at the next steps and the possible reopening of the economy, we know that there will be a need for more personal protective equipment, and we intend to increase the rate at which we receive that equipment. And we also have the domestic production coming online that we will be able to share with people before we begin to reopen the economy.
Thank you. Merci. Next question, Laura Osmond, the Canadian Press. Line open.
Good morning, Prime Minister. I wanted to ask you again about vaccines. If and when a vaccine does become available, do you envision it being mandatory? And have you had those discussions with the provinces and territories yet?
We are still, unfortunately, a long way from having a vaccine. And just finding the vaccine is the first step. The next step will be producing the vaccines in sufficient number to inoculate everyone or almost everyone. That is something that we are preparing already in terms of manufacturing and production capacity here in Canada, because we know that countries around the world will be producing for their own citizens first, and we need to be part of that as well. As to what sort of vaccination protocols will be in place, we still have a fair bit of time to reflect on that in order to get it right. Par rapport aux vaccinations, nous reconnaissons que on est encore loin de cela. Des pays à travers le monde sont en train de chercher un vaccin contre la COVID-19. Mais même une fois qu'on l'aura trouvé,
but even once we have one, that could take 6 months or a year, we will have to produce that vaccine in sufficient quantities to be able to protect citizens. So we are currently putting in place a proper production capacity here in Canada so that we can respond respond to the demand in Canada as soon as possible. Now, what will the protocols be? Who will be vaccinated first? Those are things that still need to be decided, and we have time to be able to make the right decisions in that regard.
Thank you. We've heard over and over how vital a vaccine will be because we don't fully understand the immunology of this virus. So how vital will it be to make sure that as close to everyone as possible ends up getting it in the end if one does become available?
We know vaccines will be extremely important. A vaccine will be extremely important to getting back to normal. There are situations and there are diseases for which vaccines have been searched for a long time. I think of HIV/AIDS, where there is still no vaccine even after decades of research into a vaccine. There are treatments to manage the spread of HIV, and there could be treatments that aren't a vaccine that could help us manage and get back to normal without a vaccine. But around vaccines, there are obviously going to be extremely important decisions around how to best get to that level of vaccination that will prevent further spread of COVID-19. There's a lot of studies done on that over the past years in terms of what threshold of the population needs to be vaccinated in order to prevent any spread of a disease, and that research will obviously inform decisions we take around the COVID-19 vaccine when it comes. Okay.
Of course, there's a great deal of research being done on vaccination and the level of vaccination that is necessary in order to protect our population and avoid the spread of the disease. That will certainly inform our choices when it comes to vaccination against COVID-19, but it is still quite possible that there will not be a vaccine. For over 10 years, there's been aggressive research on a vaccine on HIV, and there isn't one yet. But there are treatments that will make it possible to manage that disease much better than before, and we are seeking treatments as well that could help us to manage COVID-19 if the vaccine takes longer to be developed than we hope. So we're working on all these different options so that we can do everything we can to return to normalcy as soon as possible.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Good morning, Mr. Trudeau. With respect to the shared principles at the national level, you said that the details will be coming. Now, concretely, does the federal government intend to prohibit travel and certain movements between provinces? Well, that's a very good question, Mélanie. First of all, with respect to this common approach that we've developed and the shared principles we agreed on between the federal government and the provinces and territories, we should be sharing that with you in the next hour. But as I say, these are not specific measures. These are basic principles that will inform the measures to be taken by various governments based on their own circumstances. Now, with respect to cross-border movement, the provinces will look at their situation, and the federal government will also review the situation and will consider the principles and figure out what kind of decision has to be made to ensure everyone's safety. So this is a process that will be evolving in the coming days and weeks as we see an evolution in the spread of the virus.
This framework is one where the federal government and the provincial and territorial governments all came together to agree on principles that will underlie plans for economic recoveries. Those plans will be different from one province to the next. The specific measures put in will depend very much on the situation on the ground. But we need to be informed by a common set of criteria and measures to be in place before we look at reopening different parts of the economy. This is something that really, really matters. And all of us will be informed by these principles as we move forward on carefully reopening the economies in gradual ways.
And Sweetie, Melanie?
Follow up?
Maintenant,
Yes.
selon un sondage, M. Trudeau, il y a
Now, according
60% des
to
Canadiens qui
polls,
croient qu'un éventuel
60% of
vaccin
Canadians
contre la
think that
COVID-19
a vaccine against COVID-19 should be mandatory. What do you think of that idea? As I said, we're very far away from the time when we can make that kind of decision, or we'll have to make that decision. A vaccine is not going to happen overnight, and there are many studies that have to be carried out on the nature of COVID-19 and how we can protect the population. We know that with respect to other vaccines, in some cases there needs to be 80% immunity in the population to prevent the spread of a specific disease. Now, we don't know whether it will be the same threshold for COVID-19. That will be based on the science and the research that's underway now, as well as by the COVID-19 immunity task force that we've set up and which will be working from Montreal for the entire country. And that will inform all of our decisions as to what the next step should be.
Thank you. Next question, operator.
Thank you. Merci. Prochaine question, Benjamin Vachet, TFO. À vous.
Oui, bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau.
Santé Canada hier a
Health Canada yesterday decided to lift certain restrictions
pour les produits nettoyants. On
with
sait que
respect
ça a
to
été une
cleaning
mesure qui a été prise
products.
aussi pour les produits
And
désinfectants un peu plus tôt dans la pandémie. Le commissaire aux langues officielles
the
du Canada,
Official
la semaine dernière,
Languages
disait que c'était
Committee
justement et que c'était une question de sécurité.
says that
Pourquoi
this
alors
is
avoir
about
pris cette
people's
décision et
safety.
pourquoi on ne
Why
peut
was
pas
that
coller
decision
notamment des étiquettes
made?
temporaires sur les produits qui viennent des
And why
États-Unis,
should
par
there
exemple?
not be proper information on products coming in from the United States? That's a very good question. We need to protect the safety of consumers, and products must be labeled in both official languages. But in an extreme situation such as the one we're in now, we also recognize that there needs to be a proper balance between some vulnerabilities, and in some situations we are ready to permit unilingual information on packaging, but as I say, companies are working hard to try and rectify that. This is not something that should be accepted in Canada, and it's really just because of the extreme situation in which we find ourselves. We decided to authorize this, but we would certainly prefer that this not happen, because our linguistic duality is not just a question of our Canadian identity, it's also a question of safety for consumers. Does that mean, Mr. Trudeau, that there could be other exemptions in the coming weeks? Well, we hope we will not have to authorize other exemptions. We do hope that we can provide the proper labeling in French and English on all products as necessary, but we're now in a situation where labor and logistics are not always sufficient within these companies to make that happen. And that's why we decided that in this case it was better to ensure that the products could come in, and we're trying to ensure the safety of consumers at the same time.
Mr. Janet Silver, Global News. I want to start with the situation in Alberta. First, we have the COVID-19 outbreak of the meatpacking facility there, and now the flooding in Fort Mac. And you said in your opening remarks that your government is ready to help. I'm just wondering, will the military be brought in to help in that situation?
Public Safety Minister Bill Blair has already been in direct contact with Mayor Scott in Fort McMurray and spoken with his counterparts in the Alberta government. On the agriculture side, we've been engaged with the CFIB and with the relevant ministers in Alberta. We stand ready to help in any ways we can. And as in regards to military support, we're there for military support if we receive a request from the province. Nous allons être là pour aider.
We will be there to provide support to the provinces in these different situations. In terms of military intervention, we're certainly open to that, but we need to receive a request from the province.
To reopen the economy, there must be enough capacity to test and trace COVID-19 to control any new spread. Dr. David Naylor of the COVID-19 Immunity Task Force says he's really concerned about testing and tracing capacity. So I'm wondering, how is your government planning to address those concerns as provinces reopen?
We know we need to do much more testing. We know that testing is an important part of careful reopening of the economy, and that's why we are increasing our capacity. Yesterday, there were 26,000 tests, which is a new high, and we're continuing to increase the testing capacity with various things like more procurement of necessary swabs and domestic production, with production of the reagent, which is the chemical necessary to analyze the tests, done in New Brunswick right now to a quantity and a scale that is going to allow for larger scale testing across the country. There are many things that the federal government can do to support the testing protocols and capacities in the provinces, and we all need to improve that on that if we're going to get to a place where we can open up carefully. Okay. Le dépistage à l'échelle
massive testing will be an important component of reopening the economy, and that's why the federal government is now working with the provinces to increase their capacity. We conducted more tests yesterday than before, 26,000 across the country, and of course we must do more. And we are now ordering more testing equipment. We are also creating the necessary chemical reagents so that the entire country can conduct more testing. We know that we absolutely must do this before we start to reopen the economy. Radio-Canada, a specific question. How many tests will it take before we can reopen the economy? You've talked about common principles, but what are those principles? How many tests and what other measures will need to be in place to ensure that this works? Try to be as specific as possible. Well, to be as specific as possible would mean telling me which region you're talking about. Well, I mean right across the country. Well, I can tell you that we're dealing with a series of different pandemic responses and situations across the country. In Prince Edward Island, there were 20 cases. In Ontario and Quebec, we know that the figures are much, much higher. So we're talking about very different realities right across the country and different realities from one city to the next. So for us, the important thing is to allow the provinces to do the level of testing that is necessary in each region and each community in order to respond to needs and to the vulnerabilities on the ground. For example, there are communities where they may decide to test everyone. There may be workplaces where they want to test 50% of the people there. So there are different protocols, and our responsibility as a federal government is to ensure a much increased capacity so that the provinces can conduct the level of testing that they believe to be necessary for based on where they are and the circumstances involved. We cannot say exactly tomorrow we need these many tests done. No, this is something that is an ongoing process, and our responsibility is to be there for the provinces to ensure they can do that testing. Now, with respect to the provinces, now in your modeling, are you considering reopening the schools in Quebec? Can New Brunswick say, no, temporary foreign workers cannot come into our province? Well, the different provinces will have their own approach, and our pan-Canadian modeling tries to reflect those different realities. But it is only an overview of the country. The fact is that there is a different reality in every place across the country. And in terms of the different measures the provinces will bring in, well, they will make their own choices within their own jurisdiction that they believe are the best ones for their citizens. Good morning, Mr. Trudeau. I'd like to come back to Health Canada's decision. There are a number of francophones who are extremely offended by this. Senator Cormier said nothing justifies violating the Official Languages Act. What do you think justifies it, and what do you say to them? Well, we are in an unprecedented situation where access to products such as hand sanitizer is absolutely critical. It's an essential component. It's an essential thing that Canadians have to do to stay safe. So we had to make decisions that would be absolutely unacceptable at other times and say that in some cases we can allow those products to come in with unilingual labeling. But of course we understand that that certainly is not ideal either for the identity of our country or for consumer safety. So we do hope that this will not become a regular occurrence and that people, we know that people are now looking at ways to avoid using only unilingual labels.
I'd like to ask you about Quebec's move to reopen its elementary schools and daycares. I know it's a provincial decision, but I'd like to ask you as a parent, if you'd be concerned about sending your kids back to school so early, and as a former teacher, do you have any concerns about the teachers who are going to be called back to the classroom?
I think many people want to see the economy reopening and getting back to a semblance of normality in the coming weeks. It is natural that after a long time in isolation, we would want to see things move back towards normal. At the same time, we know we have to be very, very careful. And there are plans and there are hopes that we're going to be able to see certain parts of the country take steps, including Quebec, around elementary schools. But we're not there yet. Those projections are for a few weeks off, and one hopes that the trend lines will bring us to a place where we'll be able to see that happen. And at that moment, as the Premier said, parents will be able to make their own decisions about what is best for their students and for their kids. Okay. Je pense que nous voulons tous voir.
I think we all want to see solutions in the short term and a return to normalcy as soon as possible. But we all know that that will take some time. Even with our plans to take action in the coming weeks, we will have to ensure that the context or the situation on the ground at that time will allow us to make those decisions. And at that point, the schools and parents will be able to make their own choices as to what should be done to protect children and to keep their grandparents safe as well.
CTV National News. I just want to follow up there because there was a question about what you would do if you were a parent. Have you given that some thought? In 2 weeks, would you send your kids back to school if you were in Quebec?
I would look at what the situation looked like in 2 weeks. We know every single week we see changes in how we're doing, on where there are outbreaks, on equipment and supports available. I'd want to know what the school was planning on doing, whether the desks were going to be properly spaced, whether there would be plans at recess in terms of keeping people separated. These are all details that need to be worked out to the satisfaction not just of governments, but of the school boards, of teachers, of everyone who works in the schools, and especially of kids and their parents and grandparents. Okay.
As a parent, when I make a decision for my own children, I will want to know what the measures are that are in place. Will there be fewer students per class? Will the desks be properly spaced? And now in the playground, will there be rules in place to ensure that kids keep the proper distance from each other? Where will there be measures to protect the teachers and to make sure that they can work safely in the schools? And will there be measures that will allow them to respond in the case of a problem? So these are all questions we'll have to have answers to before we can make a decision about reopening. And that's exactly what I'm expecting to happen. I believe all levels of government, all parents and all institutions are asking these questions before they decide to relax the restriction.
Framework that you've discussed with the premiers and the modeling numbers that are coming out today, there is another brewing healthcare crisis as well because of all the the elective surgeries, right? So people that are perhaps waiting for important cancer surgery now are very uncertain as to when that could happen. So when you're discussing this with the provinces, you're looking at the modeling numbers. What benchmarks are there to start to reopen those type of important medical procedures that are sort of separate from this COVID-19 epidemic?
That is an extremely important element of any reopening and of our healthcare capacity. Of course, while we are dealing with a massive COVID-19 crisis, there are still people who need surgeries, who are facing difficult treatments, who need to access our healthcare system for other reasons. And that is why part of the frameworks agreed to by the provinces and the federal government includes healthcare system capacity, not just to handle a potential resurgence of COVID-19, but how to handle the regular needs of patients who are dealing with health issues that are not COVID-related. Okay. On sait que même dans un moment de
We know that even in the middle of COVID-19, where we're facing huge challenges with respect to the capacity of our healthcare system to cope, we know that there are also people who need special treatments that have to go to hospital for emergency problems, and we have to be able to maintain the necessary capacity for them. And that's why in terms of the principles that have been agreed on by the federal government and the provinces with respect to reopening the economy, we have to make sure that our healthcare system also has the necessary capacity to respond to a resurgence of COVID-19, but also respond to any medical emergencies and provide medical treatments that are needed by the population.
Merci beaucoup.
And that is the Prime Minister of Canada giving his daily update to Canadians on his government's approach to fight COVID-19 and the response. Today, a lot of the questions and the comments from the Prime Minister focused on what happens next, because so many of you, of course, are also wondering that. He says that within an hour or so of speaking, we should be able to see some federal provincial guidelines on how this is going to happen. These are agreed upon in principle by the provinces and the federal government. I'll bring in my colleagues, Vashi Kapelis and David Cochrane, to talk more about that. So lots of questions there around Quebec, and I'll just remind people that Quebec later, I think it's 1:30 Eastern, is going to talk about how businesses might reopen in that province. But yesterday talked about plans to reopen schools, a handful outside of Montreal, most outside of Montreal, within 2 weeks, and then even within the epicenter really of the country by May 19th. And I thought the Prime Minister's comments in terms of what he said and even what he didn't say were pretty revealing there around his thoughts on that. I'll get both of you to weigh in on that, Vashi.
Sure. Well, the Prime Minister basically said, he was asked actually by our colleague Tom Perry to reflect on the decision both as a parent and as a former teacher. And he sort of did so in saying that, well, I'm going to have to wait for those 2 weeks to pass and then better assess where is the case count, for example. What measures are the schools putting into place? How safe do people feel at the time? I think that is probably the experience of a number of parents who are sort of sitting and waiting to see how it feels in 2 weeks. But there are also a lot of questions, as you have pointed out, Rosie, coming from parents, from teachers. And while it's voluntary for parents, as David has pointed out, it's not voluntary for teachers and for staff at the school who are concerned about there still being a high level of cases in Quebec and whether or not, I guess questions around whether or not the science supports reopening schools. We know that, for example, the incidence of this virus in kids appears, and I say appears because the data is always evolving, to be lower. However, they are also, and we know about asymptomatic transmission, they are also capable of being carriers of it and transmitting it back to parents. And so there is just a heightened level of concern around why the need to go back this soon, considering other jurisdictions aren't doing it. I was also very interested in the number of questions posed to the Prime Minister, who says, I guess within the hour, we're going to be getting those federal guidelines for reopening the economy in various provinces. And it's just guidelines. He keeps on stressing it's not going to be imposed on any of the provinces. But I am interested in what those guidelines say around testing and around what a province has to show or what metrics it has to meet in order to be able to start the ball rolling on something like, for example, reopening schools or sending kids back or reopening stores. It was difficult to ascertain kind of what level of detail will be in these. It did seem like it would be pretty general. I would just offer this one point that I think is really important when it comes to testing. The kind of testing the Prime Minister was talking about is diagnostic testing. That's what's happening right now. And yes, the capacity to do so has definitely ramped up. But the parameters around that testing vary by province, and they started out pretty narrow. So who can actually get a test? That started out pretty narrow. And that's why it's been hard to sort of ascertain the full breadth of the disease or the spread of the disease here. What will offer us a better picture of that is what's known as serological testing or testing for immunity. So how many people can go back to work in this sector because they've already had it? And who needs to stay separated from them? That is very crucial to deciding when and how society reopens. The problem is that testing is not very reliable at this point. Although it's been approved in the United States, there's many studies that show it's not working that well or it's not totally accurate. And so it's undergoing a process of approval here in Canada by Health Canada, but there's still no really sure timeline or certain timeline for when that testing will be available and how reliable it will be when it is. And that is key to really this whole process of reopening the economy. So it kind of brings up the whole idea of timeline again.
Yeah, and of course, Dr. Tam yesterday talked about immunity. There's still questions around that as well, whether you can actually get the virus twice or whether we should rely on any of this information because it is a new virus, as we've all talked about before. I'll just say, David, before I get you to weigh in, that Ontario put out some fairly specific guidelines in what it's calling a roadmap, that the province has to be capable of more contact tracing, that they shouldn't see any new cases for 2 to 4 weeks, that there must be a steady decline rather in cases for 2 to 4 weeks, that they must be able to increase testing. I don't know that I've heard the same things from Quebec. Perhaps we will hear them this afternoon, but I'm not sure that they have been that precise. And I don't know if those measures that Ontario is talking about there are going to be reflected in the guidelines that the Prime Minister is talking about.
Yeah, Ontario's schools, because that is the live issue in Quebec right now, they're closed until the end of the month. I was just looking at Prince Edward Island. Prince Edward Island schools are closed until at least May 11th with the decision to be revisited in just 2 days. And you look at Prince Edward Island, it's like every day, no new cases, no new cases, no new cases, no new cases. They still haven't made a decision to reopen schools. So you have Quebec, which has more cases than any other province, which has more deaths than any other province. Now, admittedly, these are largely in long-term care homes, which has become the nightmare in this country and where the bulk of the deaths have happened. These are not happening with school-age kids. But going back to Vashi's point, that there is still a lot of uncertainty as to the ability of children to be carriers and transmitters of the disorder. And I do look at the teacher issue. Philomena Tassi, the Labour Minister, said very early in this that at the federal level, they would make sure that workers had the right to refuse to go to work if they felt their workplace was not safe because of what has happened in this whole thing. And I don't think they have jurisdiction over that in Quebec. I think that would be provincial labor ministries. But I'd be curious to know how the teachers unions there feel about this and the support staff unions feel about this. I mean, like the Prime Minister talked about, you could have desks separated. That's fine in the older grades. Kindergarten is play-based learning, for example, so there aren't really any desks and everyone congregates together, shares lunch, and sneezes all over each other, right? This is just the way it is when you're a 5 or a 6-year-old in the school system. So this is a remarkable experiment by Francois Legault here to make this choice. And if you go back to the Ontario example on businesses reopening, never mind schools reopening, every step along the way calls for 2 to 4 weeks of sustained decreases in the number of cases and in hospitalizations. There are very specific sort of benchmarks on improvement in societal transmission and in the health system capacity. And Stephen Lecce has said no schools until at least June. So Quebec is very much the outlier here with the rest of the country. I mean, a lot of provinces have already said we're closed for the rest of the year. I know Newfoundland and Labrador has done that. Alberta has done that. Jason Kenney, when he made that decision, said that there was a lot of evidence that suggested that schools would need to be closed for 10 to 12 weeks before you could see a measurable impact in community transmission. So I think we all hope the numbers trend in the direction that allows for this to happen on May 11th, but it'd be interesting to hear more from the Premier of Quebec on this today.
Yeah, I mean, I think a couple of points. As you rightly point out, the majority of cases and deaths in that province are in long-term care centers. Yesterday, it was 75 of the 84 deaths registered within the past 24 hours were all in long-term care centers. But as you've both pointed out, children can still be vectors for the virus. So, you know, I know the Prime Minister laid out, I thought in a pretty interesting way what he would be looking for as a parent, spaced apart desks and that kind of thing. In Denmark, for instance, it's only 2 kids out for recess at a time. I'm not sure how feasible that is when the kids are little. But I also would point out the Prime Minister said there's a couple weeks yet. And perhaps they are hoping not only that the data changes and supports this decision, but perhaps they're also hoping that the decision itself changes, given that François Legault last week was talking pretty openly about the notion of herd immunity, and that has very much changed. His language around that has changed after it was suggested to him by others that wasn't something to be basing decisions on. I'll come back to both of you as we wait for this federal briefing from public health officials on new modeling. We did, of course, get our first view of the national picture about 19 days ago, and they're going to update those numbers for us today. But let me bring in the CBC News Montreal host, Deborah Arbeck, because she, of course, is in Montreal and can speak to all what we've been speculating about here. Deborah, obviously lots of questions to the Prime Minister around this decision by Quebec, and we are expecting more details from the Premier about businesses today, and maybe there'll be some more dates and a sense of how this will work.
Yeah, there's a ton of pressure to get the economy rolling again here in Quebec. But what we're hearing is you can expect a slow, prudent approach and a gradual reopening, much in line with the plan announced yesterday to gradually reopen schools in this province. Now, that's happening in phases. You guys were talking about it just moments ago, starting outside Montreal May 11th and then on the island of Montreal a week later, provided everything goes well and we don't see further outbreaks. We can only expect a similar plan for the reopening of businesses. So we're hearing the province looked at how other provinces and even how other countries are going to reopen their economies for inspiration, then cherry-picked what they thought that could work here. The Greater Montreal area still, as you mentioned, considered a hot zone where most of the COVID-19 cases and deaths have been concentrated. So it's likely, like schools, businesses will reopen later in Montreal as well. So first in the regions and then eventually here on the island. Much like in the schools, social distancing will have to be maintained, so they're going to probably be industries like construction that opens first, where they have strict protocols already in place for safety, and they can reduce the number of workers on construction sites too. Construction sites would have to have water, soap for workers so they can wash their hands, for example. Residential construction, by the way, started up again last week, and their union tells us today that so far things are actually going very well, even better than it was going before COVID-19 broke out here. As for stores, well, they're likely going to begin opening up as well, but only those with outside access, so not necessarily malls in the regions. We're going to hear more from Quebec's Economy Minister, Pierre Fitzgibbon. He'll join the Premier for his daily briefing at 1 o'clock today. They'll lay out the plans then.
Okay, and Deborah, what is the reaction, I mean, broadly, of course, about the school reopening? Because Quebec does seem to be an outlier in terms of its approach to opening schools, and there are lots of people raising their eyebrows in the rest of the country. How are people feeling in Quebec about it?
Yeah, and many are raising their eyebrows here too, but there are parents who say, look, you know, it's been 6 weeks. It's time to get back to class. This is all voluntary, so they don't have to do it. Any child with a chronic illness or family members with a chronic illness should not send their kids back. That's what the government is saying. Obviously, all parents worry about the safety of their children, but some parents say that, you know, they've been balancing work at home with the kids. They're bored. They miss their kids. They need structure. structure again, and they're comfortable with the government safety plans, namely that classes, the sizes will have to be limited to 15 students, and kids will have to stay 2 meters apart, even in classrooms. Their parents are saying, though, they're worried and they're wondering why the province is putting kids through this kind of thing at this point, because there's only a month and a half left in the school year, especially on the island of Montreal, where all of the deaths, most of the deaths have been, or many of the deaths, I should say, have been concentrated. They also say it's nearly impossible to maintain safe social distancing with 5 to 12-year-olds. And teachers' unions, they're also concerned. You guys were touching on this earlier. There's less risk, of course, to children who come down with COVID-19, but older teachers, that's a totally different story. They worry about the health of those older teachers. And an added problem to all of that is if they get sick, they stay home, schools could end up with a teacher shortage. So all of these things are being weighed as we get ready to go back to school and back to work.
And CEGEPs in high schools and universities, of course, in that province, not going to reopen until the fall. So also another interesting decision. Okay, so we'll hear more from the Premier at 1:30 Eastern, if I'm not mistaken. Deborah, thank you. I appreciate you weighing in.
All right, no problem.
As I mentioned, we are standing by to bring you this modeling, the latest data from public health officials that will happen here at noon at the top of the hour. Also at noon, Parliament will reconvene in a virtual format. Everyone is invited. Of the 338 MPs, all of them make up this special COVID committee, but not all of them will be there because it is being done by Zoom, and we all know how challenging that can be. So we'll see how this first round goes here today. At noon, 12:45 is when the Prime Minister is expected to appear. There will be an in-person sitting tomorrow and another virtual one on Thursday. I'll bring back my colleagues, Vashi and David, as we wait for the federal briefing to start. Maybe we can just sort of give a picture of what we can expect based on what we saw 19 days ago on that modeling. I've only got about 2 minutes, so I'll get both of you to be brief, but what you would be looking for based on what we have already seen.
So I'll just quickly jump in, Rosie, and say that it sounded like from the Prime Minister's preview that it will be maybe an improved picture from what we saw 19 days ago, in which they presented us with two basic scenarios in which 2.5% of the population versus 5% of the population gets infected. The death range at that point due to the virus was between 11,000 and 22,000, although earlier this month it looked like the modeling was almost under assuming what the deaths would be, that it was growing faster. It looks like, depending on the province that you're in, the curve has flattened, and the Prime Minister even specifically alluded to that. So I'm looking to see overall big picture, where are we on that curve? And I know, again, it's sort of region dependent, but I think we are anxious to get a sense of have the things we've been doing, are the things that we are doing, the limits we're placing on our lives, have they had a salient effect on the progression of this virus? And it sounds like at least there is some evidence that it has.
Yep. 30 seconds for you, David. Same point.
Simple, Rosie. I'm going to be looking for hope, encouragement and progress. I mean, I know I said earlier the national model is less important than the various provincial models in terms of seeing things, but Canadians kind of are looking for a pat on the back, I think, that what they've done has been working, and the only way to do that is in raw numbers, and look at compare 19 days ago to now and to see if this really has made a difference in the way that they all say, because the new case numbers and the new death numbers every day are horrifying and tragic. Maybe the big picture can be more positive than each of those individual cases.
Okay, so we'll look for both of that. We'll look for all that you both said there. Thank you very much. We'll talk in a little bit. Thank you. As I said, we are expecting that federal picture to be presented. Important to keep in mind, something that the Public Health Agency always says, that these are projections. It is not precise, but it will give us a sense of how we are doing as a country. We'll leave you now on CBC. If you want to keep watching, CBC News Network, cbc.ca. Hi, everybody. I'm Rosemary again from Ottawa, Rosemary Barton. Glad you're with us on CBC News Network and streaming wherever you might be in the world on CBC's app and cbcnews.ca. I want to take you right to Ottawa now. The Chief Public Health Officer, Dr. Teresa Tam, speaking at this hour about federal modeling, projections on how this country is managing to fight COVID-19. Let's listen in.
40,000 people for COVID-19, with about 7% of these testing positive. Over 20,000 people have been tested daily, as provinces and territories continue to increase testing capacity.
Bonjour. Good
morning. Let's start with the latest figures across Canada. Today, there are 49,025 confirmed cases, including 2,766 deaths. To date, laboratories throughout the country have carried out over 740,000 tests, and about 7% of these have turned out positive. The provinces and territories continue to increase their testing capacity, and over 20,000 people have been getting tested every day for the past week.
Slide 2. Earlier this month, we shared our forward projections and the potential resulting impacts on the healthcare system. Today, we will present an update on our previous projections and discuss the implications for moving forward. As I have said before, models are planning tools. They allow us to forecast infection and illness rates in the short term and to explore the effectiveness of different combinations and timing of public health measures to control the epidemic.
Diapositive 2.
Slide 2. Earlier this month, we shared our forward projections and the potential resulting impacts on the healthcare system. Today, we will present an update on our previous projections and discuss their implications for moving forward. As we've said before, models are planning tools. They allow us to forecast infection and illness rates in the short term and to explore the effectiveness of different combinations and timing of public health measures to control the epidemic.
Slide 3. As a reminder, our strategy is twofold: to control the epidemic by reducing transmission through public health measures, pushing that blue curve down, and to prepare our health system to meet increased demand by raising up the dotted red line of healthcare capacity.
Diapositive 3.
Slide 3. We remind you that our strategy is twofold: to control the epidemic by reducing transmission through public health measures, pushing the blue curve down, and secondly, to prepare our health system to meet increased demand, raising up the dotted red line of healthcare capacity.
Slide 4. In order for the epidemic to die out, we need to get to the point where each infected individual is only transmitting the virus to less than one other person, which is one of the primary objectives of all of our public health measures. Prior to implementing public health control measures in March, we estimated that each infected person passed the virus onto an average of just over 2 additional people. Today, stronger controls, including physical distancing, increased testing to identify and isolate cases, and trace and quarantine contacts are helping to reduce the average number of people each case infects to just above 1.
Diapositive 4.
Slide 4. In order for the epidemic to die out, we need to get to the point where each infected individual is only transmitting the virus to less than one other person, which is one of the primary objectives of all our public health measures. Prior to implementing public health control measures in March, we estimated that each infected person passed the virus to, on average, just over 2 additional people. Today, stronger controls, including physical distancing, increased testing to identify and isolate cases and trace and quarantine contacts are helping to reduce the average number of people each case infects to just above 1.
Slide 5. So I will now provide an update on the epidemiology of COVID-19 in Canada. Slide 6. The epidemiologic picture in Canada continues to highlight regional differences, with our 2 largest provinces, Ontario and Quebec, representing more than 80% of all confirmed cases. British Columbia and Alberta are the next most affected provinces, accounting for 14% of confirmed cases. Elsewhere, case counts are lower, but all provinces and territories, with the exception of Nunavut, have reported cases. Confirmed case counts have more than doubled since April the 9th modelling briefing. This increase is largely attributable to increases reported in Quebec, Ontario, Alberta, British Columbia, and Nova Scotia. The proportion of cases who have died has increased from 2.2% on April the 9th to 5.5% as of April the 27th. It is expected that the case fatality ratio will continue to change over time. Based on available information, 17% of cases have required hospitalization, and less than 5% have required intensive care.
Diapositive 5.
Slide
On
5.
fournira d'abord une mise à jour sur l'épidémiologie de la pandémie de COVID-19 au Canada. Diapositive 6. Le tableau épidémiologique au Canada continue de mettre en évidence des différences régionales.
Differences with our two largest provinces, Ontario and Quebec, representing more than 80% of all confirmed cases. British Columbia and Alberta are the next most affected provinces, accounting for 14% of confirmed cases. Elsewhere, case counts are lower, but all provinces and territories, with the exception of Nunavut, have reported cases. Confirmed cases counts have more than doubled since the April 9th modeling briefing. This increase is largely attributable to increase reported in Quebec, Ontario, Alberta, British Columbia, and Nova Scotia. The proportion of cases who have died has increased from 2.2% on April 9th to 5.5% as of April 27th. It is expected that the case fatality ratio will continue to change over time. Based on available information, 17% of cases have required hospitalization, and less than 5% have required intensive care.
Slide 7. Based on available information, some individuals are at
so you can
increased
click
risk of
through the
severe
multiple
illness,
pages
depending
in the
on
gallery.
I just want to quickly
view
show you what
and
else is
see
happening in
more
Ottawa at this hour. This
participants.
is the Speaker of the House of Commons, Anthony Rota,
Before we
appearing
begin,
virtually for the first
today
time.
is
The Parliament
April
has done this. They are appearing in a COVID committee form rather than a typical sitting that you would see for the House of Commons. And we'll leave that up on your screen for a little bit in case we can see other MPs appearing over Zoom. This is the only shot that we've seen so far, but we should see 30 or so MPs dialing in from wherever they might be across the country to participate in this first virtual sitting of the House of Commons. It's the first go. They did do a test run yesterday. We'll see how it goes and keep monitoring it and bring you little snippets that may become interesting. Again, Anthony Rota, Speaker of the House of Commons. We will go back now to the federal briefing. Justin Trudeau, the Prime Minister, will appear at that virtual meeting of the House of Commons at 12:45.
ICU. Almost 3/4 of cases with information available reported one or more pre-existing health condition. However, no one is immune to severe outcomes of COVID-19.
Slide 8. Canada has several regional epidemics as shown here. Many factors, such as differences in subpopulations affected and laboratory testing, contribute to these regional trends. We are observing slowed epidemic growth and a leveling off of epidemic trajectories across most jurisdictions in Canada.
Diapositive 8.
Slide 8. Canada has several regional epidemics, as shown here. Many factors, such as differences in subpopulations affected and laboratory testing, contribute to these regional trends. We are observing slowed epidemic growth and a leveling off of epidemic trajectories across most jurisdictions in Canada.
Slide 9. Outbreaks in high-risk populations are the driving force behind the regional epidemics. In particular, outbreaks in long-term care and seniors' homes are driving epidemic growth in Quebec, Ontario, and Nova Scotia currently, and are responsible for the majority of all deaths in Canada. Outbreaks in other congregate living and work settings are also driving case counts in some provinces. These settings include shelters, correctional facilities, and food and agricultural work settings with congregate housing for employees.
Diapositive 9.
Slide 9.
Les éclosions dans les groupes à
Outbreaks in
risque élevé
high-risk
sont au cœur des
populations are a
épidémies
driving force
régionales.
behind the
Plus
regional
particulièrement,
epidemics. In
les
particular,
éclosions dans les foyers de
outbreaks
soins
in
de longue
long-term
durée
care
et les
and
résidences pour
seniors'
personnes
homes
âgées sont
are
responsables
driving
de l'augmentation
epidemic growth in
des cas au
Quebec,
en
Ontario,
et en Nouvelle-Écosse.
and Nova Scotia
En plus d'être
currently,
responsables
and are
de la
responsible for the
la
majority.
majorité, ça veut dire,
That is 79% of all deaths in Canada. Outbreaks in other congregate living and work settings are also driving case counts in some provinces. These settings include shelters, correctional facilities, and food and agricultural work settings with congregate housing for employees.
Slide 10. This slide compares how fast the epidemic is growing in several countries. For comparison purposes, country curves are aligned at day 0, the day the country reached its first 500 cases. Countries whose epidemics began earlier were chosen for this comparison. Canada's epidemic, the red curve, is at a somewhat earlier stage, hence the Canada line is shorter. Canada's epidemic slope is bending as the rate of growth slows down in response to our collective control efforts. Canada's total case counts continue to increase more slowly than most countries. Last time I presented this graph to you, Canada's confirmed case count was doubling every 3 to 5 days. At this time, the number of cases is doubling at a rate of every 16 days.
Diapositive 10.
Slide 10. This slide compares how fast the epidemic is growing in several countries. For comparison purposes, country curves are aligned at day 0, the day the country reached its first 500 cases. Countries whose epidemics began earlier were chosen for this comparison. Canada's epidemic, the red curve, is at a somewhat earlier stage, hence the Canada line is shorter. Canada's epidemic slope is bending as the rate of growth slows down in response to our collective control efforts. Canada's total case counts continue to increase more slowly than most other countries. Last time I presented this graph to you, Canada's confirmed case count was doubling every 3 to 5 days. At this time, the number of cases is doubling at every 16 days.
Slide 11, now we're looking at some modeling scenarios. Slide 12. It is important to recognize that models are not crystal balls and cannot predict what will happen. What models provide is a prediction of what could happen under various hypothetical scenarios to allow us to prepare for a worst-case scenario and to drive our public health actions towards a best possible outcome. Nationally, we are using 2 modeling approaches, forecasting and dynamic models. Forecasting models use actual data on the cases being reported over time in Canada to estimate forward on how many new cases we might expect in the coming week. Dynamic models don't use real-life case data, yet are useful in that they permit a longer-term view based on our knowledge of how the virus behaves. This helps us to visualize potential epidemic growth scenarios and impact of control measures that mitigate growth over time.
Slide 11, modeling scenarios. Slide 12. It is important to recognize that models are not a crystal ball and cannot predict what will happen. What models provide is a prediction of what could happen under various hypothetical scenarios to allow us to prepare for a worst-case scenario and to drive our public health actions toward a possible best outcome. Nationally, we are using 2 modeling approaches, forecasting and dynamic models. Forecasting models use actual data on the cases is being reported over time in Canada to estimate forward on how many new cases we might expect in the coming week. Dynamic models don't use real-life case data, yet are useful in that they permit a longer-term view based on our knowledge of how the virus behaves. This helps us to visualize potential epidemic growth scenarios and impact of control measures that mitigate growth over time.
Slide 13. This slide illustrates possible trajectories generated by a forecasting model that uses real Canadian case data. The graph on the left shows the predicted number of COVID-19 cases could be in the range of 53,000 to 67,000 cases by May the 5th. The graph on the right, which is new, shows the predicted number of deaths due to COVID-19 could be in the range of 3,300 to 3,900 by May the 5th. Due to changes in the epidemiology of COVID-19 in Canada, including outbreaks in high-risk settings, the initial modelling projections on April the 9th underpredicted the number of deaths. This was because a lower general population case fatality ratio was used in the model that we had at the time. But with a large number of outbreaks occurring in long-term care homes, the actual case fatality rate was higher than the modelling scenario. The models have been adjusted with a higher case fatality rate, and we will continue to make adjustments to these forecasting models over time based on real data. Right now, we are seeing the tragic paradox of the epidemic playing out. As the epidemic comes under control and the growth of cases slows, the severe outcomes and deaths continue to accrue as COVID-19 takes a heavy toll among highly susceptible populations.
Slide 13. This slide illustrates possible trajectories generated by a forecasting model that uses real Canadian case data. The graph on the left shows that the predicted number of COVID-19 cases could be in the range of 53,000 to 67,000 cases by May 5th. The graph on the right shows that the predicted number of deaths due to COVID-19 could be in the range of 3,300 to 3,900 by May 5th. Due to changes in the epidemiology of COVID-19 in Canada, including outbreaks in high-risk settings, the initial modelling projections on April 9th underpredicted the number of deaths. This was because a lower general population case fatality rate was used in the model that we had at the time. But with a large number of outbreaks occurring in long-term care homes, the actual case fatality rate was higher than the modeling scenario. The models have been adjusted with the higher case fatality rate, and we will continue to make adjustments to these forecasting models over time based on real data. Right now, we are seeing the tragic paradox of the epidemic playing out. As the epidemic comes under control and the growth of cases slows, the severe outcomes and deaths continue to accrue as COVID-19 takes a heavy toll among highly susceptible populations.
Slide 14. You are now familiar with this graph and concepts showing the potential impact of our public health measures on the size and duration of the epidemic wave. This slide illustrates the three possible scenarios we use for planning. The red curve for the sharp high peak represents the no controls or worst case scenario, where the majority of the population could be infected over a relatively short period of time. The blue line curve shows a scenario where weaker epidemic controls have been implemented to delay and reduce the height of the peak. The green smaller curve represents a best case scenario in which we implement strong public health measures to reach our objective of epidemic control. This is the scenario we are currently working towards, where each infected person only transmits to less than one other person. To stay on this green best case scenario curve, we must achieve and maintain a high degree of physical distancing while also maintaining a high rate of case detection and isolation and contact tracing and quarantine.
Diapositive 14.
Slide 14. You are now familiar with this graph and concept showing the potential impact of our public health measures on the size and duration of the epidemic wave. This slide illustrates the three possible scenarios we used for planning. The red curve, with the sharp, high peak, represents the no controls, or worst-case scenario, where the majority of the population could be infected over a relatively short period of time. The blue line curve illustrates a scenario where weaker epidemic controls have been implemented to delay and reduce the height of the peak. The green smaller curve represents a best-case scenario in which we implement strong public health measures to reach our objective of epidemic control. This is the scenario we are currently working towards, where each person infected only transmits to less than one other person. To stay on this green best-case scenario curve, we must achieve and maintain a high degree of physical distancing while also maintaining a high rate of case detection and isolation and contact tracing and quarantine.
Slide 15. All jurisdictions are working towards epidemic control. However, it is critical to remember that once we are on the downside of the slope, we must absolutely remain vigilant and continue our public health measures. By achieving epidemic control, we expect that only a small proportion of the population will be immune. So, until the population has developed a high level of immunity to the virus, or we have a vaccine in place, we have to plan to live with a manageable level of COVID-19 activity. Therefore, we anticipate that some public health measures will need to remain in place to prevent the sparking and growth of future epidemic waves.
Diapositive 15. Toutes les administrations s'efforcent de maîtriser l'épidémie. Il ne faut toutefois pas oublier que, une fois que nous serons sur la pente descendante, nous devrons à tout prix rester vigilants et poursuivre nos mesures de santé publique. En maîtrisant l'épidémie, nous nous attendons à ce que seule une faible proportion
We expect that only a small proportion of the population will be immune. So until the population has developed a high level of immunity to the virus, or we have a vaccine in place, we have to plan to live with a manageable level of COVID-19 activity. Therefore, we anticipate that some public health measures will need to remain in place to prevent the sparking and growth of future epidemic waves.
Slide 16. We continue to monitor the situation closely and will evaluate, learn, and adapt as we go. We are making clear progress to slow the spread and bring the epidemic under control, thanks to the commitment of Canadians who are following public health advice to protect themselves and others. The epidemiology of COVID-19 is not the same in all parts of the country, so when and how control measures are readjusted and or relaxed will need to be decided based on the local epidemiologic situation. It is critically important that we maintain our public health measures, including physical distancing, until we have achieved epidemic control for the first wave. Relaxing controls too quickly will squander our collective efforts to date and put us at risk of future epidemic waves. Thank you.
Slide 16, summary. We continue to monitor the situation closely and will evaluate, learn, and adapt as we go. We are making clear progress to slow the spread and bring the epidemic under control thanks to the commitment of Canadians who are following public health advice to protect themselves and others. The epidemiology of COVID-19 is not the same in all parts of the country. So when and how control measures are readjusted or relaxed will need to be decided based on the local epidemic situation. It is critically important that we maintain our public health measures, including physical distancing, until we have achieved epidemic control for the first wave. Relaxing controls too quickly could squander our collective efforts to date and put us at risk of future epidemic waves. Thank you.
Thank you, doctors. We will now open the line and the floor to questions. As usual, we will start with 3 questions from the phone and then 3 questions from the room. Vous pouvez poser vos questions dans
You can put your questions in either official language.
to 1 question, 1 follow-up. For those asking questions in the room, we ask that you make your way over to the freestanding mics. Operator Eric, over to you.
Thank you. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question,
if you have a question, please press star on your touchtone keyboard.
Is from Lina Dib de la Presse Canadienne. La parole est à vous.
You have the mic. Question. Thank you. I see in the annexes that nothing has changed in the long-term forecasts and the total number of deaths and the total number of cases. Can you explain why that wasn't adjusted in the same way that you adjusted your short-term predictions until May 5th? This is Dr. New. Thank you for the question. Answer. The slides are still in force because in the last slide we evaluated the possibilities if the infection rate is 1%, 2%, etc. That hasn't changed because we continue with our best efforts to have the lowest infection rate possible. But in the short term, given the data and the cases we have already, we can do a short-term projection. But long-term projections, this remains in place. Question. Okay. I might understand then that right now we're at the minimum, we're at the 2.5% scenario. 2.5% is infected. And my other question is, you said that in the future, a person could infect at most 1 person. So what do you mean exactly? 1.1, 1 that infects 2 point something compared to 1 who infects 1 point something? Yes, I think if you're talking about the slide on page 20, here in Canada right now, we're in the green zone. We can't give you an exact figure about the percentage of the population that's infected because we don't know if we're at the end of the first wave. And perhaps for the total epidemic, it's different. Question, but we know it won't be 1% because it's 4,000 people. You're talking about 3,800. Yes. Answer, yes, but this is always evolving. We can't always reach conclusions after the first wave in total because it depends what will happen in the next few waves. But concerning your question about the number of people that an infected person can infect in turn, at the beginning, yes, it was a little more than 2 people, 2 point something. It's very difficult to be more precise. We know that it's slightly more than 1 person. That's not great, but it's better. The objective is to have 1 person infecting less than 1 other person. That means that we can finally stop these outbreaks here in Canada.
Merci. La question suivante. The next question is from
the next question.
Laura Osmond with the Canadian Press. Please go ahead. La parole est à vous.
Thank you. I have a question about the case fatality count in the long-term dynamic scenarios. Should those be adjusted long-term? Can we expect to see more deaths, even in the best case scenario, based on the new case fatality rate?
So I think Dr. New said in French, actually, we don't know what the final outcome is yet. We are still on that first wave. And these projections are actually for essentially over the course of the pandemic itself. Until the epidemic is over, you actually don't know the true case fatality rate as the denominator and the numerators, it changes over time. So these are kind of dynamic, but until you actually get to the bottom of the epidemic, you actually don't know. So right now, of course, we think we're in that green zone. If you just look at the deaths, but we haven't got to the final outcome. So that's why I think Dr. New has just said that also in French as well. But that's green range is exactly what we're aiming for, and we believe that we're staying within that zone.
Thank you, Doctor. Follow-up?
Can we expect that the shape of that green curve to change dramatically over the next couple of weeks as provinces start to talk about carefully lifting their restrictions?
So I think this is the projection as of now, but I think it depends, on what actually happens in long-term care homes, for example. I think all provinces and territories are trying very hard to bring any outbreaks under control, to put in place these preventive measures. I think when we see the virus going into a susceptible population, then and that they're at higher risk of severe outcomes, the case fatality ratio could still change. It could still get higher, is possible. But again, these curves will be adjusted. If you see that curve itself, the graph on the right on slide 13, the further out you go in terms of from when we did the projection, the curves widen because the actual uncertainty and the spread and the range increases over time. Just because every day out from the estimate, your level of certainty decreases and those curves start spreading wider apart. But that's the range that we are forecasting at this point in time.
Thank you, Dr. Tam. Operator?
Thank you. The next question, la question suivante est de
The next question is from Marie Vastel of Le Devoir. You have the floor. Please go ahead. Question.
Circle back to the previous question. In terms of the slide at the last slide, in terms of the projected long-term deaths, depending on the percentage of the population that would be infected, I'm having a hard time understanding why the death rate isn't higher, given that you just said in the beginning that your short-term death projection had to be reviewed because we've seen more deaths in long-term care residences. So if we've already had a higher death rate, how come the long-term death rate isn't increased to take that into account? Does that make sense?
Yes, I think you do, and I think for the purposes of planning, I think we are staying within that zone. But models do have to be adjusted over time. So some of these assumptions can be adjusted over time. But I think for our planning purposes, these three different scenarios are still useful at this moment in time. But you're absolutely right. I think we will essentially be adjusting as we go as well, even on the longer term. But I think this is the nature of models. But I think for planning purposes, right now we're just sticking with these three scenarios.
Yeah, it's Dr. New. Maybe I would just add to that is that if you look at that last slide and the scenarios, the green zone, the blue zone, and so on, I think a lot of it is also based on the experience that we've seen in other countries with sort of an overall sort of a projected mortality rate. Certainly right now, as of the moment, our death rate is higher because we all understand what's been happening in long-term care facilities, et cetera. But if we obviously collectively do a better job down the road, then you might see that overall, as the overall pandemic unfolds, and at the very end of the day, when, as Dr. Tam said, you can more accurately calculate a case fatality rate, it may be closer to what maybe the experience that we're seeing in other countries and so on. So like Dr. Tam and I've said, models are useful as a tool for planning purposes, but they're certainly not the crystal ball that will exactly tell you how many people will be hospitalized or end up dying at the end of the day.
Merci, Dr. New. Marie?
Thank you, Dr. New. Follow-up? Yes, thank you. Question.
Then, I understand that the more you progress, the wider the projections are, but it is only in a week. So if you look at the situation right now, the death rate that we are seeing for the past few days overall in the country, right now, is your curve closer to the red curve of slide 13, or are we tending closer to the green curve? In other words, right now, with what we're seeing in the past few days in terms of death rates per day or cases per day, where do you see the curve going most likely? Or is it the black curve in the middle?
It's Dr. New. I'll start off and hand it over to Dr. Tam. As we've said, is that the reason we only want to give, let's say, short-term projections is because of that level of uncertainty. The farther out you go, and as you can see here, based on the model, sort of the projections by our experts, what we talk about usually in epidemiology and modeling is what we call a 95% confidence interval, and you can see that's why we have, quote, the upper and lower limit, and so in the middle is sort of where we think we're tracking, and we have that, quote, upper limit and lower limit in terms of the confidence limits, but you're right, we have to actually see what unfolds over the coming days. The other point I think we've made repeatedly is that, if you're looking at deaths, et cetera, it's kind of hard to look at predictions because they really are the result in many ways of activities, what the general population, what was happening in long-term care facilities sort of like 2 or 3 weeks ago, obviously, because, by the time the incubation period, unfolds and testing, et cetera, and so on. So obviously what we do today will have a direct impact on what we see in terms of the actual data 2 to 3 weeks out from now. So that I think is an important point to underline. Dr. Tam?
Maybe I'll just suggest those with better eyes than me on a tiny piece of paper right now. If you looked at today's date, I think and we just indicated that we had 2,766 deaths. It is trending within the line of prediction. And so if you just went across this graph a couple of days from the last time we checked in on the data, it is trending as this particular curve and within that range. So we will see in the next few days what happens.
Thank you, doctors. Now we will go in the room. Stevie?
Hi, thank you very much for doing this today. You've said that 79% of deaths have been tied to long-term care facilities, and the deaths have only gone up since the federal government released its previous modeling a few weeks ago. What did the new model show about how effective the various measures have been to try to control outbreaks in long-term care homes and seniors' homes? And as well, how many of the overall deaths in today's models will be tied to long-term care facilities?
Again, whatever we do today will result in the sort of final picture that we're going to see. And so working really, really hard in getting outbreaks under controls, not just in the long-term care homes, but some of the other settings that are also laid out in that slide, including the persons who have experiencing homelessness. Some of correctional institutes and others are really important right now. So I think what we do now to get those settings prepared will eventually influence the final picture for sure. I think, though, if you looked at the various composite amount of information we gave you, is that it is really slowing down. You know, the doubling of the cases went from about 3 to 5 days the last time we spoke to now closer to every 16. And the epidemic is slowing down in the different provinces and territories. But the data that we present at the national level, I think there was a question about, you know, where that effective reproduction number is at. What we're showing you is a composite picture. What you will see that in some jurisdictions, they actually haven't had community transmission. Their R is going to be under 1. And others are still working at this, some of the bigger provinces, as they are working really hard at getting some of the clusters under control. I think in our discussion with chief medical officers, we're also trying to look at the epidemiology itself, because the transmission dynamics inside a relatively confined cluster is different than looking at general community transmission as well. So that kind of epidemiology, provinces will take into account as they look at when and how they're going to relax some of their measures.
Follow up?
Yes. Ontario and Quebec represent about 80% of confirmed cases. And given that it appears there's no leveling off right now in either province, do you believe it's too early for the premiers and those governments to be considering lifting restrictions and even considering opening schools and industries?
Well, I think in all jurisdictions, including Ontario and Quebec, things are slowing down despite the fact that, of course, we're still seeing cases and they are all working really hard. I think it is important to collectively plan forwards. And so with Chief Medical Officer of Health, we collaborated on looking at the common criteria, some of which are very much reflected in what the provinces have spoken to, like Ontario, for example, looking at getting the epidemic under control, making sure you have the public health capacity in place for testing as well as contact tracing and case isolation and quarantine, as well as ensuring that your healthcare surge capacity is still there. And so all of those kind of factors go into the way that they make the decisions as well. So we are also collectively looking at when the time is right for each jurisdiction, what some of those initial measures could be in terms of easing back some of those public health measures. And certainly educational settings, including schools, are very much part of that discussion, including the fact that even with limited evidence, the graph that we showed you show that the younger populations don't experience the severe illness as much as those persons over the age of 60. So that's part of the considerations, I think, in terms of safe return of kids to school. I think what we are really happy to see is that every jurisdiction have said that we really need to move cautiously. So you may want to start with some schools in an area that isn't really in the hot zone. And then you progressively monitor what happens, and then you gradually ease back certain other settings as well. So I see that all provinces are really sort of aligned with some of those public health criteria, and that they are moving cautiously through those plans. So I think planning is actually important for work settings as well. I think chief medical officers have said, here are some public health parameters, but we need different work settings and sectors who knows their own workplace really well to see if they can come up with the kind of plans that are needed in preparation for when the time is right.
Yeah, it's Dr. New. Maybe I can just add to that. Certainly the authorities in each of the provinces and territories they're closer to the ground than obviously we are at the federal level. So they have more data to work with, and exactly what's been happening in their jurisdictions. So I'll pick the province of Quebec as an example. We all know that the tragedy that's unfolding in their long-term care facilities. So certainly the efforts there are they're doubling and redoubling it, looking at testing residents and staff and so on and so forth. So that's a special situation. But then if you look at, quote, the rest of the general population, that's also depending on the region. So certainly Montreal is a hotspot. And so what they may wish to do in Montreal, even in terms of opening schools and so on, may be to a different schedule or rhythm that they may consider in other parts of the province. Also to add what Dr. Tam said, that all of us, including obviously our counterparts in Quebec and the other provinces, are looking at the scientific evidence and seeing how it's evolving. And in terms of the children, it's very interesting. There is limited data out there, but we're looking at it carefully. As Dr. Tam said, it appears that children in general have milder symptoms, obviously, compared to older adults. Another point that's interesting is based on some of the evidence we looked at, the children also don't seem to be sort of major transmitters or responsible for further propagation. So all those types of evidence and what we have in terms of the data is certainly, I think, being an important part of the considerations that all public health authorities in each of the provinces and territories are looking at. Thank you.
Thank you, Dr. Tam and Dr. New. Charles Starr?
Good morning. Dr. Tam, can you help me understand? So a lot of this looks a lot like what you presented April 9th, and the assumption in the graph on the page 14 suggests that you see, again, 1 to 10% of the population infected with strong controls, which we have now, and you see it peaking in the summer and then petering out by the fall. I'm just curious if you can help me understand, first of all, what's the number of the population? Is that the 10% we see on page 21? You see that up to 10%, 3.7 million under your scenario that would peter out by the fall would be infected. And I'm curious if that's then what you're projecting. I don't understand how you see the epidemic petering out when you yourself have cautioned against any assumptions about herd immunity by then, and we won't have a vaccine by then. We won't, so help me understand what you're saying there.
So these are just planning scenarios.
But you must have numbers, right? You have actual numbers.
So these are the tables that you see in, I think, in the annex. And the green, the blue, and the red correspond to those numbers. And these, the 1 to 10% in the green bars at the back is what you will sort of project as being under that green curve, and the blue one and the red one, for example, and the attack rates that have been, indicated on slide 14. Those are the numbers that are being displayed in that table, and you can certainly refer to that. And we don't have no control, so I think that can be put aside. We are trying to, of course, working very hard, and I think we are staying in that green zone. This is for the course of the pandemic, and you're right in that, the following slide shows that epidemic could result in further, because there's no, we have to do some of the serologic investigations to know what the underlying proportion of the population infected is. But it's very likely that we don't have that high level of immunity. So when we discuss across the country with the chief medical officers, that is the assumption that we have to maintain a certain level of public health measures, have to be really careful, and we are actually going to be living with COVID-19 for the near future and monitoring very carefully so that if there's any upswing, that any cases and contacts have to be identified and managed so that you don't get that upswing again. Now, I have to say that some of the modeling work going on right now with the dynamic models they're basically showing what will happen if we didn't achieve epidemic control and didn't have effective public health measures in place when we begin to ease some of these measures, is that we could see a second wave that is even bigger than the first. So everything is dependent on what we're doing right now. So if we do everything that we're doing right now and maintaining and easing through things really slowly and cautiously, we can get to the bottom of that initial wave. But even then, you have to be extremely careful about what is going to happen. And so, and different shifts, and if you don't detect those cases and manage them really fast, that's when you could potentially get that second wave. So I think conceptually that's what slide 15 is trying to say, is that we've got to keep going with our measures.
Yeah, it's Dr. Newman. I would just add to that. Certainly, Dr. Tam and myself, we're not thinking that, as you said, that the epidemic or pandemic is going to peter out in Canada. You know, with all of our collective efforts, we're flattening the curve, and we're certainly hopeful that we're hopefully close to, or if not, getting towards the downside of that first wave. But there are a couple of things that certainly will be in play as we move forward. Certainly, the basic core principles in terms of good physical distancing, people maintaining that, the hand washing, the cough etiquette, all those basic things will still be in play. And of course, as Dr. Tam has also mentioned, each of the provinces and territories, if they're considering in terms of what they might want to do in terms of maybe loosening or relaxing some of the public health measures, you have to assure you have a good surveillance system, good laboratory capacity, public health system that's in place to be able to rapidly detect, isolate cases and so on, so that you are able to see if the measures are maybe not having any intended effect. And then as well, you need to make sure that you have the hospital capacity, should there be an upswing in cases, that you're able to accommodate patients that come in and so on and so forth. So there's lots of things in play that all of the chief MOHs are looking at. And certainly what we're looking at is not that after the first wave where we're in the clear. We're anticipating a second, third, who knows how many waves. But we're trying to find a manageable level in terms of, as you say, opening up the economy, relaxing measures so people can go outdoors, but with a manageable level of a certain, I guess, COVID-19 activity that we sort of percolating, I guess, in the general population. Each province and territory is different in terms of their own context, what the issues are in terms of how it's being transmitted within key subpopulations, long-term care facilities, et cetera. So those are some of the considerations that obviously each of the chief medical officers of health, as well as ourselves on our special advisory committee, are discussing on a daily basis.
Can you confirm then, based on what I'm seeing here, it looks a lot like what you released before. So it's not an actual model. You haven't provided your input data, your methodology, the reproduction number you assumed. This is a synopsis of modeling that the department has done based on a bunch of different Canadian and international experts you've consulted. Is that correct? And if it is, to what extent do you have any concerns about what you're looking at in your planning scenarios when you're only working with less than 60%, it seems, of case data to work with to make your numbers on hospitalization and ICU? Maybe you can clarify some of that. I still don't quite understand why you're not releasing actual mathematical models done by your agency.
Yes, so we know that you have to use a whole suite of models depending on the question that you're trying to answer. So I think it is actually really great that we're consulting across the country with many different academics and experts. Some of the methods that we're using have already been published, of course. And in the annex slide, you'll see some
Okay, I also want to show you the other thing that's happening in Ottawa at this hour, and that is a sitting of the special COVID-19 committee. So it is not the House of Commons sitting, just to clarify with the help of some experts on Twitter. The House of Commons can only meet in person, and that will happen tomorrow. But this is the virtual sitting of the COVID-19 committee. There are, although you cannot tell from that shot of the Speaker of the House, Anthony Rota, on the right, 297 MPs who have dialed in via Zoom to participate in this special committee, at which ministers are taking and answering questions. And they are even tabling petitions as you would inside a regular sitting of the House of Commons. But this is a committee sitting, just to be very clear. But there are a lot of MPs represented, which was one of the primary concerns from opposition parties, particularly the Conservatives, 297 of them at this meeting. The Prime Minister expected to appear shortly if he's not already there. And again, the House of Commons itself will reconvene tomorrow for an in-person sitting, and Thursday they will try this virtual tack again. Apparently, the biggest issue has been the mute and unmute, as you can expect, as you've probably experienced yourself. That does seem to be the most challenging thing when these unfold virtually. So Anthony Rota there, the Speaker of the House of Commons, managing the committee. On your right, And on your left, the Chief Public Health Officer, Dr. Theresa Tam, talking more about the modeling that they have presented today. I'm just trying to see if the Speaker will actually throw to an MP so you can see a little bit more what that's going to look like. There you go. And so that's Conservative MP. I'm trying to remember who it is. Garnet Genuis, I believe. He is speaking. So that's how that's going to play out. We'll continue to monitor it, of course, through the couple of hours that it will sit. But it does appear to be working. So that's good for democracy. Let's go back to the Federal Public Health Agency briefing. We have about 5 minutes. And as soon as we see François Legault, the Premier of Quebec, pop up in Quebec City, we'll bring that to you. He is announcing plans to reopen businesses in that province. Here's the Deputy Chief Public Health Officer now.
Issues, infrastructure, and so on. And I think, obviously, it's a good representation. We're all working together, I think, really well. And I think in the future, to be quite honest, those are things we need to look at in terms of how data is managed, how data is collected, transferred even at local level to provincial level, and then to the federal level. So those are things that we need to look at improving in the future.
Thank you. We'll be taking one last question. Globe and Mail.
Marika Walsh at the Globe and Mail. I have one question, one follow-up. You say we're in the green zone right now, so pretty low case rates. You mentioned in your opening remarks that means that low infection means that there's a higher proportion of people still open for infection later. So what does that mean for the measures? Does that mean that until we have better treatment or a vaccine, we will have this physical distancing in place at a certain level? And if we will maintain some physical distancing until that point, what is that physical distancing?
So that's, I think you grasp the concept that, it's likely that a significant proportion of our population is not immune. We're in the immunity task force that we talked about earlier this week. Some of the serological studies are going to try and answer some of those questions in looking at different parts of the population and the level of immunity or the level of infection, at least exposure to the virus. We still actually have to study the immunological response to the virus and how people develop immunity and how long they last for over time. So it's quite a dynamic piece that actually hasn't really been answered yet. So those questions will remain, which means you're right that we will not go back to what life will be like before January of this year. Public health authorities will be easing things very gradually, but we talk about sort of living with the virus for a significant number of months and until there's enough level of immunity. But buying some time has lots of advantages because I think there are many clinical trials with treatments, not just the vaccine piece, but hopefully to manage the serious outcomes of illnesses and deaths as well. What I think, at the beginning, the easing off of some of these measures would be certain settings where they can manage the physical distancing and manage protocols and workplaces where you can reduce transmission. I think that all chief medical officers are thinking, you're not going to be having those giant mass gatherings. You're not going to be, having those kind of settings where we know transmission is going to accelerate really fast. People are going to be managing the size of those gatherings and having protocols in schools, workplaces, and other aspects of life where these basic fundamental hygienic measures, the policies and protocols, as well as all those public health capacities have to be in place. And you're going to have to dial some of them up again if you're going to see some cases. So I think I would love to be able to tell Canadians that life will be back to exactly where we were in December of last year. But no, we're going to be living in having different routines, different daily routines. But I think all chief medical officers sees with that we need to balance the effectiveness of measures, we need to study them, but also balancing with any unintended consequences. We know the impacts to mental health, to gender-based violence, to other aspects of society and the economy. So it is a very delicate balance that we all have to really manage very, very well. But we all understand that if the virus accelerates again, that would be a massive setback to the gains that we've already had. So we've got to keep going at it. And so I think this is absolutely still a marathon, I think.
And you've talked to us over the last few weeks about how as you get more data, you have better quality data, you get a better sense of the trajectory of it, that there would be changes in the modeling. And yet in the long-term modeling, we don't see any changes today. So what specifically is the data you are missing today that you need in order to improve the models, in order to make them more accurate or reflect better what Canada is experiencing?
Well, I think there's a suite of models, and these were the initial models for planning purposes. You've got to kind of plan for the worst, even if you're not going to actually get there, but really function so that you can achieve the best. So that is the concept of that particular type of model. And so I think all of those public health measures still hold. There are many, many modelers right now working like 24/7, I think, across the academic sector and also within the agency working with them, who are looking at these dynamic models, feeding in all sorts of scenarios of what happens when you begin to relax different measures as to what the outcomes are. And I think those were actually quite interesting to see. But the bottom line that they're going to always say is that whatever we do, and if we eased off things too fast, and we can't monitor it, you might see a resurgence and a second wave that is bigger than that initial one. And so I think that is the message that they will be trying to convey as they are doing the modeling. And it is a message that the public health arena really take to heart.
Merci beaucoup. Thank you, doctors. C'est ce qui m'a fait la conférence.
Thank you. That concludes today's press conference.
Okay, that is the federal briefing from public health officials. They're giving us a sense of the national projections, modeling that they have put together over the past just more than 3 weeks, 19 days or so from the last time we got this. And I guess the good news, if you're looking for some, and you may well be these days, is that the measures, the public health measures, the very strict public health measures we're all living under right now are in fact working. I'll give you one example that the Dr. Tam presented to us. When she last gave this update 9 days ago, cases were doubling every 3 days. We have now managed to slow that to a doubling of cases every 16 days. So that's pretty remarkable. She also says, though, that the centers that continue to be a huge concern, long-term care centers and places where people have to live together, long-term care centers now make up 79% of deaths in this country. Let me bring you now live to some history being made. That is the Prime Minister speaking from his home office in the first virtual sitting of the COVID committee. Let's listen in to the PM right now.
Huge challenges we might face if tests are unreliable, if we could have an undetected resurgence of COVID-19. We are incredibly pleased by how many innovative Canadian companies and individuals have put forward new solutions, and Health Canada is prioritizing and rapidly going through a process of evaluating these tests. But at the same time, we cannot compromise on not just the safety of individual Canadians through this test, but the safety of our entire country. We have approved a number of different tests. We will be approving more, but it needs to be done in a safe way with the real recovery of our country as the core goal that we're facing.
Mr. Scheer. Mr. Speaker, information has come out that a Canadian company called Blue Dot was able to track incidents of COVID-19 in China as early as December of 2019. Blue Dot has indicated that among their clients are 12 countries, including frontline healthcare providers here in Canada. Can the Prime Minister indicate whether or not the Government of Canada had access to Blue Dot's information back in December? Mr. Prime Minister.
Thank you, Mr. Speaker. We were advised in early January of the possibility of what became COVID-19 in China. We made sure that we were monitoring intelligence sources, working with our Five Eyes partners on that. As you highlight, a Canadian company was involved in tracking the spread early on, but we are glad to have that company with us now. Our information around what was going on in China came to us through a range of intelligence services, public accounting and reporting, as well as our Five Eyes and other allies around the world. We continue to work with all those allies to understand exactly what's going on around the world and how we can best position ourselves. We are working with a range of technology companies and innovators to ensure that we're actually doing everything we can to monitor and track the spread of COVID-19 in Canada. There's lots more to do, but Canadian innovation will certainly be a part of that as we move forward.
If you want to continue watching this, the House of Commons sitting virtually for this COVID committee, this extraordinary meeting of almost 300 MPs, and in this case, the leader of the official opposition questioning the Prime Minister. You can go to our website, cbc.ca/politics.